I was born in Steubenville at the Gill Hospital in July 1st, 1960, and I was Loretta Isidore. And I lived on Lincoln Heights for 27 years till I got married to Jim Rasta. I have a son, Joseph. He is going to be 25 in May. I try and keep everybody like close-knit. I try and be not the leader of the family, but like keeping everybody together. My husband and I were going through a difficult time. He retired and I lost my medical insurance. And when you don't have any insurance, nobody wants to see you. My legs were a little bit swollen, and my one started like the skin broke and was weeping. And I thought, this isn't getting any better. I was feeling overwhelmed and afraid, and I really didn't know what to do and where to get help. So I decided I better call and do something because I was getting really concerned about my health. I came down and I saw Mary.
The very first time I met Loretta, she was sitting in one of the exam rooms sobbing. Her legs were draining.
And her and I had an instant connection. She would make me feel comfortable because I was nervous when I first came. I didn't know what to expect.
You could tell that this was her last hope, that maybe she could get some relief for her legs.
She looked at my legs. I had lab work done. My blood pressure was elevated.
I remember the day that Loretta came in as a patient. She was pretty sad and she was pretty sick. Her legs were in terrible shape, and you could just tell on her face that she was overwhelmed and stressed and fearful.
They regulated my blood pressure, and then I got on some medication, and it helped with the swelling of my legs, and my legs seemed to be going better.
So routinely when women come in, we ask them, when was your last mammogram, when was your last pap smear?
I hadn't had a mammogram in a long time, and just because I didn't have the health insurance, I couldn't really go and get one.
So we said, oh, well, we can connect you with the breast cancer and cervical program here.
So they made me an appointment to get a mammogram and images. They said, we saw something on your mammogram. We're not sure what it is, but we don't want to ignore it. They said it might be nothing, but it might be something. Well, a week later, I get a phone call. It came back suspicious to very suspicious. And they said, you need to see a surgeon. So he said, we need to take action. He said, it's very small, but he said, we need to remove it. So I was nervous about surgery. And he said it was a stage 1 breast cancer. Of any type of scenario, this is what you hope for, that it was caught early. So he said, now your next step is radiation. And now I'm going, radiation? And I'm thinking, how am I going to pay for this? Because I don't have any insurance.
This is the kind of thing where people have medical bills for years and years that they're trying to pay when you have to have surgery, radiation, testing, follow-up.
I think one of the important things too is not only do we take care of people who are medically uninsured, but we also take care of people who are underinsured, people who have huge deductibles that will never be, or maybe half their income is only to pay for insurance, or people that are on Medicare and they've fallen into that donut hole, and we're able to carry them through that difficult time. We call that filling the gap. We fill the gap for our folks in our community who are underinsured, no insurance, or they're in this time in their life where maybe they're between jobs. Maybe their job doesn't offer insurance, but we really take pride in filling that gap.
Through the health center, Amanda helped me get insurance. When it kicked in, it paid for all my treatments. And thank goodness, because I had 15 radiation treatments.
Without insurance, she would have had to pay out of pocket, but that self-pay could be hundreds of thousands of dollars, and she did not have to do that because she came to us. All of her testing, her surgery, her follow-up, her radiation, everything was covered. So for her, this really was a miracle that is helping to ensure she lives a long and wonderful life.
Who knows, if I hadn't had that mammogram, a couple years down the road what that mammogram would have looked like. It might have been a completely different situation. Now that I'm cancer-free, my legs are getting better, I have a lot to look forward to. It was a huge weight off my shoulders because I wasn't sure what was going to happen when I heard cancer, because it could have been a lot worse.
Seeing her today, you know, she's happy, she's hopeful, she feels better, she's grateful, and we're grateful to have gotten to know her, because when I look at her, I know I'm in the right place, Ohio Valley Health Center.
The health center provided me with hope and optimism. I felt better about myself. I knew my blood pressure was down, it was controlled, my lab work was good. It's like, oh, I'm starting to turn things around here.
Loretta's story is classic. She is the classic person that comes to the clinic feeling hopeless and helpless and overwhelmed, and there are so many patient stories where we have been able to provide them the care, and it changes their life. It changes what they can then go out and do. Some of them go back to work. Some of them get a surgery that they've needed. And Loretta's the classic kind of patient. And we are so happy that we can be a part of that time in her life.
People in our area need to know that the health center is here for them. I mean, look what they've done for me. We need that. There are a lot of people that are uninsured and they don't know what to do or where to go. And Ohio Valley Health Center is here to help them. And they will guide them and tell them exactly where they need to go and what they need to do. And look what they did for me. They saved my life.